Welcome, everybody. My name is Mike McKee, one of the professors here at the Department of Family Medicine and also at University of Michigan. Also have a secondary appointment at Physical Medicine Rehabilitation. I'm an associate director for the Center for Disability Health and Wellness and work closely with our director, Dr. Michelle Mead. We are thrilled to have this webinar, and this webinar is really going to be focusing on the social justice through a disability health lens. And this is in honor of Reverend Dr. Martin Luther King Jr. I do also want to acknowledge our funders through the National Institutes of Disabilities, Independent Living, and Rehabilitation Research. We are fortunate to have several grants through them and has really been instrumental to really provide support and community partnerships. And we are going to now move on to our next slide just to talk about some ground rules. This event is being recorded for future It's being recorded for future use and will be posted on the CDHW website. It's important to make sure that we speak up, speak clearly, and at a moderate rate so that our American Sign Language interpreters can effectively translate. I also want to make sure everybody's aware that we do have ASL interpreters and we also have our AI transcription as well. All attendees will be muted by default, and we will also have a Q&A function, which will be available for questions and comments, and we welcome those. We want this to be an engaging discussion. If you prefer to speak, please raise your hand, and we will unmute you and welcome you into the webinar. Please state your name before asking your question and take a moment to fill out the evaluation survey. We want your feedback. We want to make sure that we hear different comments from the community and hopefully engage that in future webinars. And next slide, please. So for the Center of Disability Health and Wellness, I want to briefly just talk about our mission and also our vision. We want to enhance access to safe, high-quality care for people with disabilities. The CDHW works in partnership with our disability community. Many are represented here, and we're really fortunate to have that. And our goal is really to innovate, educate, amplify, and implement research, education, and clinical advocacy to enhance the health and wellness of people with disabilities by considering intersectional identities and also connecting people, ideas, and opportunities across the University of Michigan, as well as the state of Michigan and beyond. Next slide, please. So what I would just highlight, we have several pillars and processes here, including knowledge and translation, research, education and training, technical assistance, and capacity building. And this all really gets interwoven in our community engagement that we really value here. If you have more questions or need for information about our mission and vision, please reach out and we can share them offline. Next slide, please. So now I'm delighted to go ahead and introduce Dr. Brandy Bentley, and I want to provide a brief bio. She's an assistant professor here at the Department of Family Medicine at the University of Michigan and a community-trained doula, and she is based in Detroit. She focuses on advancing social justice by working to improve perinatal outcomes for disabled parents through inclusive, accessible, and community-centered models of care. Dr. Bentley is committed to promoting equity in maternal and family health by connecting research, education, and community practice to help ensure everyone has equitable access to optimal health outcomes. So we are very fortunate. Dr. Bentley, welcome, and I will turn it over to you.
Awesome. Thank you, Dr. McKee. This is Dr. Bentley speaking. Good afternoon, everyone, and welcome. I am so honored to be here with you today. Today's event is titled Social Justice Through a Disability Justice Lens, and that framing is very intentional. So today's conversation sits at the intersection of civil rights and disability justice. And I think in these spaces, it's always important to name how deeply connected these movements are. Both movements share a really deep commitment to dignity, access, self-determination, and the belief that no one should be denied care, opportunity, or humanity. I think one of the common quotes that we see posted on MLK Day and social media really speaks to how Dr. Martin Luther King Jr. called out inequality. And in one of his quotes, he takes it a step further by saying, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think in today's conversation is really important for us to note that that truth is not confined to history, but it's lived every day, especially by disabled Black communities navigating systems shaped by systemic racism, ableism, and inequality. Today, we will be debuting a very powerful film project created in partnership by the Center for Disability Health and Wellness and Teddy Dorsette and Teddy Boy Films and Entertainment. At the heart of this project was a simple but urgent invitation for folks to share their stories regarding the impact of systemic racism and ableism in healthcare settings. And when I was thinking about setting the intentions for this session, something that I really want each of us to sit with today is what lives beyond the film. So it's really important to note that these experiences don't end when the camera stops and the documentary is over or today's conversation concludes. It's real life, and we are carrying these stories in our bodies, in our families, in our friendships, in our communities. They're interwoven in the moments of care and the moments of harm that we're experiencing. They live in doctors' offices, emergency rooms, waiting rooms, and also the quiet decisions that we have to make every day regarding our care and our health and well-being. So today's event is not just about watching, but it's about witnessing. We're bringing together our panelists who are featured stars in the film, not in the purpose of performing their pain, but to expand the conversation, to share more context, and to engage with each of you in real time. So we want to elevate the power and purpose of moving from story to dialogue and from dialogue to deeper understanding. I also want to name that a part of this process can be really uncomfortable. They are heavy stories. For many of us, it may surface big emotions. We may feel anger, we may feel pain, grief, recognition. We may feel a sense of community in the stories that we hear and listen to today. But with all of that, there is discomfort that is associated with telling the truth. And so before we jump in, I just want to offer gratitude and thanks to everyone who is participating. First, to our panelists and others who have shared their stories. We thank you for your vulnerability, your honesty, and most importantly, the emotional labor that it takes to sit in these spaces and share very harmful experiences in public spaces. And I also want to extend a gratitude to our participants for being willing to listen and to be present in this space and to engage with care. I think a big step is being present, and being here today matters. So thank you all for joining us. Like I shared, we are joined by two super incredible leaders and some of my favorite people who starred in the film project. So I'm very excited to be here with Mrs. Lisa Franklin and Mrs. Shantae Favors, and I will share brief bios for them both. So starting with Mrs. Lisa Franklin, she is a respected disability rights advocate and the founder, president, and CEO of Warriors on Wheels of Metropolitan Detroit, also known as WOW, established in 2008. A lifelong Detroiter, Lisa has led transformative initiatives across Metro Detroit, including securing citywide curb cuts, improving DDOT paratransit services, training municipal law enforcement officers, and helping establish the city's Office of Disability Affairs. She also made history as the first Detroiter to serve on the Regional Transit Authority Board of Directors in 2012. Welcome, Lisa. And joining her, we have Mrs. Shantae Favors. Mrs. Favors is a wife, mother, and disability advocate from Taylor, Michigan, driven by a passion for meaningful change. As Miss Wheelchair Michigan 2024 and first runner-up for Miss Wheelchair America 2025, she has used her platform to advance personal care assistance and safeguards for caregivers. She is a founder of FAVE, which stands for Fortitude Advocates Valiant Everywhere, an organization rooted in courage, advocacy, and community impact. After a career as a director of care was altered by a work-related injury, she chose to transform adversity into advocacy and actions to bridge the gap between those who provide care and those who receive it. We're super grateful for the wisdom, honesty, and leadership that both of our leaders bring into today's space. Before we start the film, we want to take a moment to ground ourselves in a few principles for engagement. As I shared earlier today, today's conversation may be heavy for some, and so we want to uphold a few shared agreements. First, we ask what's shared here stays here, and what's learned here leaves here. So we ask that you honor everyone's confidentiality, and that we keep personal stories in the room. However, the lessons that we learn together can be shared more broadly. So as we exit today's space, you don't have to say, well, Brandy shared this experience that was XYZ, but rather what was the greater lesson that we learned, and how can that be shared more broadly? We also ask that participants speak from our own experiences, so to use I statements and share our truths without making assumptions or generalizations about others or other communities. If in conversations like this you usually hold back, we ask that you consider stepping forward. And if you tend to speak often, we ask that you practice stepping back. So just be mindful of your mic time and how much time you're spending sharing throughout the conversation. We also invite you to care for yourself as you see fit. Please feel free to stretch, hydrate, or take breaks, and care for yourself as strong emotions may arise. We want you to know that your well-being comes first. And then lastly, we also ask that you accept and expect non-closure. So today's conversation is a part of a larger journey. And at the end of it, you may realize that you have more questions than answers, and that is okay. A big piece of being in this space is co-creation. And so I will pause here if anyone wants to drop something in the chat or come off mute if there's an additional community conversation guideline that you'd like to uplift now. And as folks are thinking about that, I will also note that Andy just shared a tip sheet in the chat. This resource was developed by Tamika Sitchin Spruce. She's a disability justice advocate and a valuable CDHW partner. Tamika's work is grounded in disability justice, and this tip sheet is meant to support engagement throughout today's conversation. So if you take a look at it, it has information on some key terms, some reflection questions, and also a list of resources. So we want you to use that as a tool for today's conversation, but also to support additional action that'll be taken beyond today's event. All right, so if we don't have any other things in the chat, we can go ahead and get started.
Well, I think that it's designed for people who have money, people who have great insurance. And so when it comes to, I think people with disabilities, because of the stigma of people with disabilities being institutionalized centuries down, that stigma has carried forward And I think that a lot of people, probably in the health system as well, have been traumatized by it. And so they've carried it up to today. And so that's why we see, and I believe we get a lot of ill treatment when it comes to healthcare. And we're put into a box and categorized as maybe less than.
Again, it's a very complicated system. As a patient turned CNA and soon to be into my career, I see the differences. But it also depends on the location. For example, in Chicago, there are a lot of low-income people who are on government welfare benefits coming in. How the medical staff takes care of them is questionable. Then I moved here to Michigan, and I do see a difference compared to there. Not every location provides the same level of care for their people. So who is the system really designed for? It depends on the location, the money, and education level.
I believe that the healthcare system is designed with the one-size-fits-all. It often excludes the marginalized society and community as far as people with disabilities. I find myself when I'm going to a new doctor's office who was not familiar with me, specifically not a rehabilitation center, they're not designed with people with disability in mind. We're often excluded.
For hearing people, absolutely. I'll give you two simple examples. If I wanted to be independent and go up to the check-in desk, I would give my name to check in. They will respond using their voice to speak to me, and that's when I'd have to depend on an interpreter. Another example, if the nurse is ready to call a name and they call mine, I would not be able to hear it. I have to depend on the interpreter again. If the system were designed for deaf people, there would be tools such as caption screens and accessible communication methods to accommodate us, but there aren't.
The healthcare system was not understanding about my health, but the healthcare system needs to be more educated enough to understand what we people with all disabilities.
The system always puts hearing people first, people without disabilities. They're too comfortable with easy interaction. But when they work with disabled people, they don't even know what to do. They become awkward. How can I provide accessibility for you? How can I provide interpreters? There are deaf people, deaf-blind people.
This is Brandy. Thank you, Micah, for showing that first clip. So what we'll do for the remainder is we have a series of clips and some discussion questions. And so after each video, we will hold space for discussion or questions, reflections. And for that first one, I will first open it up to Lisa and Shantae to see if either of you have anything else you'd like to share to answer that first question of who is the healthcare system designed for?
Thank you, Brandy. First of all, I'd like to say that I'm really honored and to be here today and to be invited to be here today. So thank you so much for that. Um, there was something interesting that one of the participants in the film said. She was a deaf young lady. It didn't show her name, so I can't recall, but it was interesting when she said that they just really get awkward when it comes to people with disabilities and the healthcare system. They just don't know what to do. But there are so many different ways and so many different things that they can do to be able to communicate effectively and to understand our plight. And it's just an education process, I think. And the more that we are vocal and the more that we communicate with um, the professionals in the healthcare system, I think the better they would understand. And it's sad that it's been so long that we've gotten to this point now. And it's something that Martin Luther King said about we have to make the invisible visible. And so when we go into an office, they just need to make the accommodations. I think that it's left up to the office managers to make sure that they connect the dots and make sure that people, when they come into their offices, that they're comfortable and they have whatever they need in order to feel seen. And so this is a very important discussion. And I hope there are a lot of clinicians that are on here that will take heed to that, because our health is just as much important as the next person's health is. And we cannot live without the proper care. And once you get something, anything can happen to turn you off, to make you step back and maybe not even want to approach a doctor when you have an issue. And that is not good for anyone's health, and it's not good for your soul either. So that's what I wanted to interject right here. Thank you.
Thank you, Brandy. Very, very good video. I too wanted to touch on the word awkward that was used in the video. A lot of times it's not just only being seen, but being heard. And far too often in the field, when we're going to these doctor offices, especially when you're an individual like myself that does require assistance, and you have another individual with you, oftentimes healthcare professions tend to patronize, where they're speaking to the person with you and not necessarily to you. And I myself am an extremely educated woman who worked in the healthcare field. I was a director. I facilitated the care of over 100 people, had a staff of over 24 under me, and I found myself on the other side of the equation of care. So I think it's extremely important to get a full understanding and knowing that you yourself, and truth be told, will find yourself on this side of the equation of care. We really truly have to understand. You have to stop and listen first. Listening is so important. It is critical. I know for me personally, listening really could have saved me from being in the situation I'm in now. When I was injured, went to the hospital by EMS. The hospital, they did the necessary testing. Now they don't know that I'm going to be, a quadriplegic, but they did the necessary testing, far as MRI, CAT scan, X-rays, and it showed that I had a spinal cord injury from my C2 to my C7. I had got in a state like mentally, I wasn't talking like myself, so I probably came off as someone less educated. But in that moment, they made a decision simply to load me up with medication, place a C-collar on me for 7 days, and then send me to a nursing home facility without intervention. I laid in a nursing home for another 14 days. So this 21 days with a broken neck. By the grace of God, I am still here. I was then sent from the nursing home to another facility for a Botox evaluation, as they felt like Botox would then release my hands, release my feet, will loosen me up. I get to that facility, and it was then that the doctor, listening and hearing, seeing, and then sent me to another hospital where I underwent emergency surgery. And I believe personally, because of that situation,
7.5 years later, I'm still in this situation. I cannot dress myself. I can't bathe myself. I can't do any ADLs myself. I require another individual to simply live a dignified quality of life. So I think that it's extremely important to put people first, put yourself in that situation. Don't be awkward. Don't automatically assume that someone that's going through a physical disability. And far too often for people that look like me, they tend to think that drug seeking or mentally ill, and sometimes they dismiss the physical disability that's happening. Thank you.
This is Brandy. Thank you, Shantae and Lisa, for sharing those reflections. We have time for maybe a couple of more. Are there any folks in the audience who would like to share? And the chat is open. You can also feel free to unmute if you'd like to speak out. Okay, I see. You can put comments in the question and answer section. And see, we have one from Michelle who says, Shantae specifically brought up the intersection between race and disability. Yes. Would you like to say more about that, Shantae, and your experiences?
Yes, I think there's a big stigma. There's I'm well known. I'm a disability advocate. I meet a lot of individuals, and I go to different places and speak with other people who have this lived experience. And when I see where people that look like me are at in the care that sometimes lack versus those that look different, it's alarming. It is extremely alarming. Um, black and brown people tend to quote unquote drug seek is what they're thinking. It's very dismissive. It's extremely dismissive. And so I think that that in itself, and it could have a lot to do from things that happened back in the 80s and the 70s. I know I'm an 80s baby, but I know I hear stories often how back in I think it was the 70s or the 80s, it was a drug epidemic that took place, and crack cocaine became very prevalent, especially in the African American community. And so then when that drug of choice just didn't work anymore, people went to things like morphine and opiates and things of that sort. And so oftentimes they see a person with a physical disability tend to just literally push that to something else, like, oh, you're less than, especially like in a urban community, they tend to think it's something else, and it truly can be a matter of life or death. Like you really are in these fields, you swear an oath to, protect people, to provide that dignified quality care. You go into these schools to learn these different specialties in order to help people. And sometimes you not sometimes, all the time, you must be blind. You have to be colorblind in the field of healthcare. You have to be colorblind. And sometimes a lot of times people unconsciously make decisions based off the way someone looks. And they may not have an ounce of prejudice, racism inside of them, but it is literally the stigma. It is what you grow up hearing, it's what you grow up seeing, and then the mainstream media, like the things you're seeing on TV, even the news, you can't turn on anything right now today without seeing stuff right now, and disability, race and disability. So I think that often plays a huge part. And again, it could be a matter of life or death. We can't go back and make a brand new start, but we can start to make a brand new end. And it's up to us to be the very change that we want to see there's more generations and more generations to follow, and it is really up to us to do our part. So I know, as someone who's not only disabled but did work in the healthcare field, I am doing everything in my reachable power to bridge the gap between those that provide care and those that receive care. Thank you.
I agree 100% with Shantae. It is just amazing how, because of the color of your skin and the way the abilities that you have, and some people may want to say the abilities that you don't have, affects how people look at you. I know that at one point when I went to the doctor, and I had several broken ribs, a crushed wrist, closed head injury, and the spinal cord injury where my T6 was crushed, but my spinal cord was not severed. So for many years, I really did have pain in my chest. I didn't know where it was coming from because I'm brown secure. So all my nerves got mumbled and jumbled up. So I just knew that the pain was excruciating in my chest. And that's the same thing that happened to me. They thought that my pain was exaggerated, and they wanted to discontinue the type of medication that they were giving me for my pain, and they wanted to change me over to Tylenol when I was using a lot stronger medication. But the thing was, I just had to, the pain was so excruciating, I just had to wean myself away from it and accept the pain that I was having and just live on every day as if, everything was okay. But that it was not fair, and it was really inhumane because the pain really was intolerable. And so, because I am vocal, and Shantae is vocal, and we can speak up for ourselves. We can go so far to explain our situations and make ourselves heard. But what about the individuals with disabilities who may have a speech impediment? Or what about the individuals who are deaf? What about the individuals who are nonverbal? So these individuals go throughout life just swallowing the hard pill of accepting where they are because no one will listen and no one hears them. And so, and it's really unfortunate because it shortens your lifespan. It really does. When you're not heard from professionals that are trained and are there to take care of you and have their health in their hands. So, thank you. Thank you.
This is Brandy. Thank you both. We also have a comment or question from Andrea. Please feel free to share.
Can you hear me?
Yes.
Oh, wonderful, wonderful. This is, I wasn't expecting to be into such a deep dive about this, but really, thank you so much for everyone for sharing. So, I'm a parent of a student with chronic health conditions and neuropsychological conditions. Myself, I believe that some of this can relate to some of the things I experience as well, but also having worked in the field of disability rights for the last 30 years. Just one of the prominent things I hear when people talk about coming into the offices and like how they're treated. And I think the difference between certainly people being available to hear them and support them, but the difference between accommodating environment and an inclusive environment still like strikes me as such a big gap, because when you come into an inclusive environment that's already like set up with the device you need to communicate, that just says you belong here. We get the integrity of your person and who you are, and we're available for you. Like the other thing needs to be there. It's good, but you know, what a lift it would be for, and what a amazing change it would be for all of our systems to be moving toward those inclusive designs. So that is something that is at the heart of my work. But for my own child with chronic health conditions, things that started to show up when he was about maybe in fourth grade, years of different doctors, different things coming up, sleep tests, this, that. Sometimes they just see a healthy boy and they're like, you're fine. And so it took so much time. And then recently he had a diagnosis of something that ended up being a precancerous condition. And when I looked into what caused that, some of the things that caused that are at the source of a lot of the symptoms he's had for years and years. And so I had to actually force his doctor to make a referral to do blood work. And months went by when he was home with me, and I was like, well, why didn't you ever refer him to endocrinology? Like, he doesn't need an endocrinology referral, you know. So eventually I said, well, you know, since you didn't give us time to get to the right doctor, I want you to do X blood work. So she did a bunch of blood work. Well, sure enough, there's two different things going on, two different categories of things. But in this area, there was something that was just glaring. And we had to run around making sure he didn't have cancer and sending him to tests. This is during the semester. And nobody knows he's going through this. And this previous semester, he was affected by it. And people didn't care. Professor didn't care. Disability office didn't care. Nobody cared. And as this went on, he even said, well, I had a surgery for something. Like I ended up having to get a surgery, you know, like, and, you know, it's just as things fold out, like, even like, because you can look at him and say, this looks like a healthy boy, healthy young man, right? Who's, you know, sometimes bedridden, sometimes weak, sometimes can't function. And so I'm glad now we're getting to the bottom of things. But honestly, like, I'm not there with him for his appointment. Actually, we finally have the appointment. Ironically, the appointment's today. So I just ran. This is why I was on the phone, like ran to fax the list because I'm not there. And being a person with neuropsychological conditions, he is not going to remember everything. Number one, he's not going to answer all the questions. He's going to want to be fine because he also has trauma and self-advocacy fatigue. And I'm looking at a kid where I want to make sure you don't have cancer. I want to make sure you can like treat this so that you feel better. I want to make sure nothing worse happens for you. You know, like, but I'm talking years. Like we're talking, you know, what is this now? 10 years. So I didn't expect to have these feelings associations, but I'm very grateful to this platform, and I'll let you go back. Thank you so much for the work you're doing. And thanks everyone for sharing.
This is Brandy. Thank you, Andrea, for sharing your story. I think it touched on a lot of the things that we're seeing in the chat as well. There have been folks who have made comments about invisible or non-apparent disabilities and the assumption that if someone can't necessarily discern a person is disabled, that they have to work harder to prove that accommodations or certain services are needed. So there's definitely some shared themes there. And Dr. McKee also uplifted parts of the conversation where we begin talking about what things in clinical spaces are helping to bridge those gaps. And we'll have some time for that conversation after one of our videos as well. But for now, we're going to transition to our next video, Micah, and we'll have another space for discussion following that. Thank you all.
The program that I was in made deaf people seem like we were helpless. made it seem like all of us have families to interpret for us. They believe that we don't have a voice for ourselves. I was appalled. I said, "Excuse me, I'm a deaf person myself. And I'm telling you, no, you need to provide interpreters. You should be communicating directly with the deaf person, not their family." The program emphasizes that the patient knows their bodies best. So you'd ask their family instead of the deaf person?
I get very frustration when they healthcare push IT aside when they are not listening to me when I know about my health issues. And IT comes from me IT like being old you don't matter as I goes older. IT very angry.
A lot of times when you're a person with a physical disability, a lot of people think it's emotional or cognitive, which there's nothing wrong with that. But if it doesn't vote well when people talk to you, they don't talk to you like you understand it. They don't treat you like you're capable of being responsible for yourself. I can recall one particular instance I had to be hospitalized and I couldn't be. And they kept asking me questions like, where was my husband? Where was my family? And I would tell them. So apparently they thought that I was causing myself to be sick because I was unhappy. And their response was to shut me down.
Many dentists would not provide interpreters. Most of them would think writing back and forth works just fine. But how would you explain the complexity in my teeth? How am I supposed to understand the big words? I did give it a try with writing, but the communication was between me, the dentist, and the assistant. It was taking too much time. I asked them to explain what the big words were. The dentist froze and had the assistant write it down. They took too long. I had enough.
I requested a deaf-blind certified interpreter. They said no, and that my visuals seemed fine. "You can see me, right? You can use the iPad." I said, "No, I need pro-tactile, not visual cues. It's important. I care about my health." They were giving me a hard time.
In my experience, that they won't believe that you're in pain. They think that you're there just to get drugs. And it's not fair, and we suffer. We suffer from those things. Yeah. That's one experience. And I know that I have a relative who was in really bad pain, and he is a doctor. And he is also working at a university in Maryland. And he was in really bad pain. And he went to the emergency room, and they wouldn't believe him. So he called my husband, and he told him, give him a urine sample, and it had blood in it. As soon as he put it on the counter, they rushed him to the back. But there's another example of just by the color of his skin, that they actually didn't believe that he was in pain. And he was there they were thinking he was there probably just to get medication. And that's a lot of things that I've come up against,
This is Brandy. Thank you, Micah. Our second video discussed dismissal and harm in healthcare. So we'll now open it up to discussion. And for all the participants, if you have comments or questions, you can feel free to put them in the Q&A box, and then we'll all be able to see those there. And so I'll hold some space for folks to begin typing those out or sharing if they'd like to share. And while we do that, Lisa or Shantae, if either of you would like to build on any of the things we talked about in the video, please feel free to do so.
Well, this goes back to Andrea's comment about what happened with her and her son and what they're experiencing. And personally, I was surprised to hear that. because it brought me to think that it's not only the color of your skin, but more the disability. And that just really surprised me that she had to do all of that convincing to the doctors to go further because her son looked healthy, you know. And there's like a flip side to the coin. Because her son looked healthy, she has to advocate harder for him to get the care that he needs. And for people who are intersection, we have a disability and are brown or black, we have to constantly hold up our guard because they think that all we want is drugs. So it's just it's so unfair, and there's so much to learn from this. And I'm so glad that you are doing this conversation because, like I said, I thought that just because the color of my skin, I was getting treated differently. But now I'm seeing today from the talks that we're having that the disability is the number one, maybe the number one factor in the experiences that we are having with the medical profession. And it's just, it's really sad because we didn't ask for where we are today. Like Shantae, both of us were involved in an accident. And so we didn't ask for this, but God knows how to give you a mission and a purpose. And He gives you the voice to speak out to make the change. So I'm just happy that I'm in that position. And I look from what comes out of this whole discussion, and I look forward to hearing what some of the professionals have to say about what they're hearing today. Thank you.
Thank you. I can go back and speak one on Andrea said. I think though what tends to happen, I'm gonna go back to race. I think that the color of your skin does play a huge part. On top of a disability, I think when it's more so of an invisible disability, that's when you tend to see things like what Andrea experienced, right? Because they don't they don't know what they don't see, right? So well, we roll in the first thing that you see when you see me, because I asked someone, what is the first thing you see when you see me? And this lady said, well, I see your beautiful sparkling pink wheelchair when I see you. And I'm thinking, like, you don't see the beautiful woman sitting in this chair. I'm controlling this chair. This chair does not roll without me. But the first thing people see when they see me is my wheelchair. And so back to the setting of healthcare, I think it goes back to the medical model of the medical model. There is a perception. When people see us, they tend to say, "Oh, like Jamie said in the video, they didn't believe her. She was going through these things." But a lot of times, the medical model is it's this inherent disability that, oh, you need to be fixed, or oh, I'm so sorry, or uh, you just need to be, fixing it. And the idea of fixing things is not the same way as fixing the actual illness or the sickness. If that makes sense, it's just like, oh, we need to find this cure. But the race for disability, I'm gonna say it is the huge stigma part. I experienced it myself, and I'm gonna go back to my profession before I became disabled. And so to know that I once was on that side, the other side of the equation of care, where I am making sure that 100 plus people are receiving the proper care, whether it's going to dialysis, getting their blood pressure, getting ADLs, getting going out for, I don't know, labs, calling BMI, calling someone for mobile imaging to assure that they get these things, and then to I was at work, tripped and fell, walking upstairs, break my neck. And then that same day, days later, I am being treated like I am nothing. I am being treated like I am just this black woman that just wants this medication. And truth be told, I don't like medication. Just like back to what Lisa was saying, that she had to literally suffer. Like she became like almost fearful, and again, a vocal individual, because I myself experienced that too, very vocal, but afraid to say, um yeah, I need something a little stronger, or I need something, this is not working, because I am afraid of what people are going to think about me. Although I am vocal, I am very confident. I have, I don't know, I'm a people person, very outgoing, very outspoken, but I still have that fear of being judged. What are they going to think about me? Because although I'm disabled, I still want to believe that I am this professional woman. Now I can't do that job that I did before, and I can't walk, but I roll, and I roll with the purpose, and I roll with my head held high. I literally have turned adversities into something so powerful, and that pain into purpose. But I still, in the back of my mind, that conscious, what do they think about me? What do they think? What is this doctor thinking that I'm coming in, rolling, saying, hey, I need something a little stronger. This is not working. What do I do? So consciously, I got to put it in the back of my mind, tuck it in my pocket, say, hey, Shantae, we're going to roll this out for as long as you can, for as long as you can, till you just can't take it no more, which, like Lisa said, it's not fair. It is not right. It is inhumane. We are going to see people that we trust. I trust. I have a set of doctors right now that I wholeheartedly trust. I wholeheartedly trust, and I do believe there are some doctors that do not see, um, they see Shantae. They see the person. They see the person outside of this share, outside of the skin. But when I am going into new places, they don't. They do not see me first. They see my disability, and they see my color, my skin. And so, oftentimes, I am stuck between a rock and a hard place, wondering, thinking, just like, what do they think? What are they going to think about me? That shouldn't be something that goes to my mind, because I'm already going through so much, Oh, I'm getting emotional. I'm going through a lot. It takes a lot to, have to have someone else, get me up, get me dressed, get me showered, just to get through the day. It take a lot. There are 24 hours in a day, 7 days in a week, 365 days in a year. And that was 365 days in a year, every day, every single day. It is hard. It is hard, but you got to keep pushing. You got to keep going. You got to keep going, because, if you for me, if I let this disability, it doesn't define me, I defined it. Like I said, I'm the one controlling the chair. I am the one that control my destiny, my purpose. And so we shouldn't have to worry about, or, demote or make ourselves say, hey, I'm gonna hide this because I don't want people to judge me. I don't want people doing this. We shouldn't have to do that. I'm sorry.
This is Brandy. That's okay. Thank you, Shantae. You're getting lots of love and support from folks in their reactions. There's also a lot of solidarity being shared in the chat. Folks are speaking to similar experiences of having to prove their pain, or living at that intersection of being Black and disabled and being a woman, and what that means and how that influences their care. So thank you all for your vulnerability and sharing, and supporting one another throughout the comments as well. One of the questions that we had come up is from Dr. Martha Banks, and their question says, can you briefly address invisible disabilities and the assumption that Black women with invisible disabilities are not disabled, resulting in our having to prove that we need accommodations and or rehabilitation? And I think participants and some of the panelists have spoken a little bit to this, but if Lisa or Shantae want to add a little bit more here, I'll pause so you can jump in.
It's just really unfortunate that you do. Because I'm so vocal and I appear to be healthy, people will look at me and think, oh, that you're being lazy, that you don't need the care that you need. Now, currently, I have to pick my battles because I don't have a caregiver. And when it comes to family, they have to choose whether to be here to help me for nothing, or go to work and make money for the necessities that are needed to raise a family. And so it's it really makes you emotional, but it's just it's really sad. It's really sad that people who don't can't get what they need to make it from day to day. And it's really, really sad. And Shantae is really fortunate that she has a family that can be there for her 24/7. But when you do have to depend on somebody to help you dress, help you, fix meals, help do this and that, a lot of times people are have to make the choice of whether you go out any way you can or you stay home. And so, being a Black female, um, people assume that I can do more than I can do just by my appearance and the way that I get out and the way that I try to make it where I need to be when I need to be there. But it's a total it's almost theatrical the way you have to plan your days out and make sure that you do things by a certain time or try to get help a week in advance to make sure that somebody can accommodate you when you need them. And um, I can cook things by myself, but I need help putting it in the oven, taking it out of the oven, um, and help dressing. And so a lot of times I need help in more than 2 or 3 hours. Where in this system that we have, they want to give you 2 hours or 3 hours of care. Where it may take a person with disabilities to get in and excuse me, to get in and out of the shower and get dressed. That may be a 4 hour process, and to get something to eat, and to get put all of your outerwear on and your shoes and socks, because that's something that I cannot do for the bottom half because I have a T6 spinal cord injury. So I have to have help with the bottom half. And so there's a lot of planning just to get out of the house. And when you don't have someone there to assist you, it just, like I say, you have to pick your battles.
Thank you, Shante speaking. I'm gonna touch back. So I can't speak completely on the intersection with invisible disability versus visible disability because I have both, right? So my physical disability it has truly caused of an invisible disability. I suffer from PTSD. I suffer from depression. I see a neuropsychologist. I suffer from I don't know like things that it plays on the mental health, right? So when people see me, if I'm going to, thankfully, an amazing neuropsychologist that I can relate with. It's very relatable, and so I don't have to fight so hard now. But I recall when I first got disabled, and then, they give you these ink block tests, right? What do you see? So I may look at this particular piece of black ink and I may see a dog. So it's kind of funny a little bit. But you may see this dog or this cat or something like that, and then they tend to focus on, oh my God, what are you talking about? And so I think sometimes when you have an invisible disability, it almost get pushed to the side, especially if you are someone that looks the part. And when I say looks the part, you are neatly dressed, you are not disheveled, like your appearance just looks so good that oftentimes that invisible disability just it gets dismissed, and it shouldn't be like that. There are many people, prominent people from, I mean, years and years and years ago that had these invisible disabilities that was absolutely amazing. And so, but in today's society, it just get pushed to the back burner. And then what that tends to do is add another problem on another problem because hey, I had this one problem where I'm depressed, right? So depression, talk about it, can lead to suicide, often untreated, but tends to happen a lot because a lot of times that invisible disability get ignored, especially again in our community, and not only just with the healthcare professions. There's a stigma on mental health. Like you could be going through some things and keep it to yourself and end up turning this so much more because you didn't have you was taught from little girl, like especially our African American boys, they are taught to be strong, they're taught to be masculine. You don't cry, if you fell down, hurt yourself, why are you crying, right? So you taught to keep that to yourself. Or I know for me, I remember growing up, what happens in this house stays in this house, right? So what happens in this house stays in this house. And so oftentimes when you're going through something, you keep it inside. When you keep it inside, again, it turned to something else. So then it'd be like almost like a parallel. You have this uh, physical disability now, you have this mental health disability, this emotional disability, and you have three things now that you're dealing with at once that's really being ignored. They tend to push these different types of medication that you may not need versus something that you do need, and the things that you do need, they think you want. No, it ain't a want, it's a need. I only want it because I need it. And so that happens a lot in healthcare field. It happens a lot. I don't care what type of field of healthcare. It could be physical therapy, occupational therapy. It could be your internal medicine doctor, your surgeon. It could be all types that you see it truly happens. Or you can have something going on physically and it get dismissed completely as something mentally. Or vice versa. It could be something mentally that plays out and they say, hey, let's push this to the part. And I know for sure I experienced this. I have a Baffigan pump, if anyone's familiar. I have a Baffigan pump that was unfortunately damaged in 2024 September. And so I went into a Baffigan withdrawal. So I was on life support. I ended up mentally I was thinking that I was seeing stuff that wasn't there. It had played on me so bad. And then I had one facility that wasn't familiar with the pump itself, the Baffigan pump itself. And so when I'm, coming to it before I completely slip out, I'm asking, hey, am I an AD? I ain't AD. Doctor clearly looked at me and said, what are you doing? Googling? Like, what are you doing? Or do you need mental help? Like, do you need mental help? So at this point, I don't know at the time I need mental help, but yeah, I need mental help. I'm in a Baffigan withdrawal that's now playing on me mentally, physically, emotionally, to the point that, hey, I just want to be done, like completely done. God forbid I speak that out loud, because now if I speak that out loud, like I just want to be done, everything I need physically is going out the window because they call psych coming right in, psychiatrists coming in. They're going to completely dismiss that. So I do think that the invisible disability, it definitely get pushed to the back. If you look the part, if your appearance look good, you have a very hard time getting the help that you need. Now, if you have an invisible disability, maybe a little deceivable or something, you're gonna get help. You're gonna probably get a little help before somebody that's put together.
This is Brandy. Thank you all for your responses and your questions and comments in the chat. I think it really highlights how complex and interconnected some of the issues we're talking about today are. And I'm really appreciative for the opportunity to have space to have conversation around these topics. And thank you for using the Q&A. We're able to see everything. And if you click the answered portion at the top, we can still see all of the comments and questions that are housed in the Q&A. So thank you all for sharing there. And Micah, we're ready for the next video.
At that time, I couldn't sign. I was paralyzed. I couldn't sign. How was I supposed to communicate? The interpreter was baffled. I tried using facial expressions, notes, and a pen to work with the interpreter, but they immediately gave up on me. I felt completely blocked from communicating. The nurse looked at me, not knowing what to do. I broke down in tears. Another time, there was a deafblind certified interpreter. The interpreter had no problem understanding me. Finally, I could use facial expressions with the interpreter's support. We used notes, and I could point at the words. The interpreter quickly translated for me. I felt a huge sense of relief and thanked the interpreter. She was deafblind certified and she understood me. It was a near coma experience. I had experienced communication barriers. I couldn't sign, and that part was very scary.
I had a condition called hyperemesis. That's where morning sickness persists. Morning, noon, and night, all day, every day. It caused blood pressure fluctuations, hallucinations, all types of things because I was really dehydrated. So I spent a lot of time going in and out of the hospital emergency room to get care. And the first time I can remember having a horrible experience was once I had to go to the emergency room. And the nurse that was taking care of me asked me, how dare I think about having a child? She said that, why would you put strain on the Medicaid system like that? It was horrible.
Whereas it could be someone with the exact same condition, they're going to cater to that person much more faster because, unfortunately, we are get put into a one-story fits all. One Black person's story may make a world of a difference to affect the outcome for the next person's situation, which our situation may be completely different. And so focus on a lot of people drug seek. So if they met one encounter of one African American person that's disabled, that's drug seeking, we all are drug seeking. Versus the next person, they have a real experience, they have real pain, and that pain is going to get treated like it's real. When my pain is real, my experience is real.
I worked at a different job. Most of the patients were half Black, half white. Even though the place was private pay, still, they got different treatment, different approaches. So, do I think that would change? It's the system and how we approach it that needs change, and how we work with people of different races. The racism is still there.
When lack of accessible, when they don't know I am hard of hearing with speech impairments. More training and reach out to the community of people with communicate such as ASL interpreters and other communication devices.
A lot of the nurses are white. The doctors are a lot more diverse. But the nurses, most of the nurses depend on the interpreter. I mentioned about how the nurses would speak to the interpreters directly, but they were supposed to speak to me. That wasn't right. The interpreters are often white. Both of them are often white. So I sense microaggressions.
If we go to a doctor with an ailment, we expect that doctor to be professional and look at us as an individual with an ailment, and we expect them to treat us and look over whatever they see. And we have a thing that we say in the community, person first. And see the person, not the disability. See the person, not the skin color. And so, if they treat it, it's beneficial to them as well. Because, insurance is insurance. A patient is a patient. And that's the way that I would wish and hope that they treated everybody the same.
This is Brandy. Thank you, Micah, for that third video. And we'll now open it back up for more discussion. As a reminder, you can leave comments or questions in the Q&A. It's the button that looks like a chat box with a question mark on the inside of it. And so I'll give time for folks to start responding there. And I'll pass it to Shantae and Lisa for any remarks.
Thank you, Brandy. Shante speaking. In one of the video, she says the system that needs to change, and I wholeheartedly agree. It is the system that needs to change, and that is the power of yet. And I think that the power of yet with individuals is flooding this cause, especially our healthcare professions and those that are advocates. That's the power of yet. The system needs to change. We have to continue to tell our stories. We have to make it the language plain, especially those that's providing the care. You could see someone, skin color, a disability, and completely ignore their real situation. And you got to remember your livelihood is on the line. And so if the system change and you truly put the person first and have a person centered, not disability centered, not skin color centered, not prejudgment or prejudging a person based off what they look like, and truly putting yourself or your loved one in that very same situation. Go back to the textbook. Go back to what you hear and truly value and understand, and here to understand, not just here, but here to understand and place that person life at the very top. Because remember, when you do that, you are not only elevating status, you are literally protecting your livelihood. Because I don't know if you treat me, but if I come to your office and I'm having a real problem and it's dismissive and something happened, I'm sorry, but you'll have to see my lawyer, and I don't want that. We don't want to have to do that. We want to make it so that I'm entrusting you with my life. You're entrusting my insurance to pay your bill. You're trusting the Medicaid, the insurance system to pay you what you rightfully owe. I just want to get what I rightfully need to simply live, to live a dignified quality of life. So the systems need to change. And again, that is the power of yet. Thank you.
And the reality is the system can change. And in the United States, 1 in 4 Americans have a disability. 1 in 4. That's some power. That's a lot of power. And it would be beneficial to the entire healthcare system if that was recognized. There would be done in order to reach those people. So it's just really amazing. And this whole, and all of the work they're doing at U of M important to the livelihood that and it's greatly appreciated.
Thank you both for sharing. I also wanted to uplift another comment that says, this reminds me of when my deaf nephew took my daughter to the hospital for cancer follow-up. My daughter told the nurse her cousin needed to be shown where the restroom is. He's a 30-year-old man, and the nurse said, "Oh, you have to go pee-pee," just naming that. So really talking about the infantilization of individuals with disabilities. And I think similar to what Shantae and Lisa have shared is that there is bias and racism and ableism that's baked into everyday practice. Like these are things that folks are normalizing. It's made routine, and it's something that people aren't quick to call out. So as you all think and reflect on that last clip, what would you say are some small, realistic changes in clinical practice that would immediately improve care? How do we prevent equity efforts from being just temporary or performative or dependent on one or two individuals to carry the work forward? And I think it really speaks to something else that was mentioned in the clip where one of the interpreters was speaking directly to the nurse instead of the person being seen for care, right? And just that dismissal of folks' humanity and their presence in different spaces. Like we don't need a training for that, right? That is a quick adjustment. Speak directly to the patient, even if they're using an interpreter. So are there other small things that you think would have a substantial impact on care that can be enacted almost immediately?
Well, I think the more stories we hear and the more people that come out of the woodworks and reach individuals that can tell their story will help. Come on, the nurse said, do you have to go pee pee? This is a 30-year-old man and you're talking to him like he's two. And it's horrifying, but it's real. And that's a lot that happens with people with disabilities. And especially when it's a visible disability and people tend to talk differently. I've heard people shout at people who are blind because it's just they have no knowledge, just knowledge. So people have to be taught, but they don't even know where to go to find out. So I don't know if reaching um, various hospitals, doctors' offices, management teams, people in healthcare that actually reach a lot of people, conferences. I don't know what has to happen, but it has to happen on a larger scale so that the word can get out. But the stories help a lot because it's real, and people can understand more and they empathize more when they actually hear real things that are happening in the community. Thank you.
Dante speaking. I think that we must remember that we coexist. We coexist. You can't have healthcare without patients. You we coexist. So I think that if we collaborate and build this alliance that place people at the forefront of our endeavors and truly do what we can to bridge the divide. It's a divide, and I think that is where the change come in at, to remember that we coexist. We're like this teammate, right? I am the captain, you are the co-captain, or you're the captain, I'm the co-captain, but we are on the same team. And if we work together, we can really make change. We could save lives, and we can eradicate what is happening now in our healthcare system. We coexist. That's all it takes is working together. So I myself am someone that is extremely open to collaborate. Right? If you have a clinic, you may need somebody to come in. I'm pretty sure Lisa will echo this. You may need someone to come in to talk to someone with a disability, come in to talk to your staff, about how to treat us. Sometimes it just takes a conversation. And so each one, reach one to teach one, that is real. We have to reach one to teach one. And if we do that, we can really make a world of a difference. We could bridge the divide. And so I am, one, just grateful for the setting, grateful for this conversation, grateful that, someone had the mindset and you all had taking out of time, 2 hours out of your time to come and hear, you know, from people with the lived experience what we have to go through. That in itself tells me that you want to be a part of the change. That tells me that you are not comfortable with the uncomfortable. You are not comfortable with the way things are. And so I just want to say thank you. Thank you. So maybe you can go tell a coworker, and that coworker can go tell another coworker that we got to build this alliance. We got to come together, work with not only just disabled people, people that are sick, right? And build this alliance again, my favorite saying is the power of yet, because yet it just has three words, three little letters, three letters, but yet holds so much weight, holds so much power, holds so much. It tells a story that's waiting to be told, and so it's the power of yet. Thank you.
This is Brandy. I love that, Shantae. Thank you all for sharing. I just want to elevate quickly some of the themes coming from the chat. People are really speaking to the need for disability education early on. So even before medical school training, how are we teaching K-12 about disability and how are we integrating that into every facet of our lives, so that people are developing greater empathy and greater understanding of different disabilities. And I think very similar to what Lisa and Shantae have discussed is that disability touches all of us. So it is something that we should be actively having conversation about and actively learning how we all can be in community and what it looks like for us to acknowledge everybody's needs and strengths for care. So I think those are some of the themes that are being elevated throughout the Q&A. Thank you all for sharing there. Continue to feel free to place more reactions or questions in the Q&A section. And with that, I will ask Micah to play our final video.
Dr. Bentley, would you mind addressing an additional question from the Q&A while Micah works to get the video up?
Sure. Let's see. Yes. So someone brought up that disabled people and understanding the compassion we need is not included in the books. It's something the system needs to explore by having disabled representatives in the medical system. And I think that holds so true and is a reflection of some of the things that we've been hearing as well. It's like we need disabled providers. We need people integrated at every level of the system. It's not enough to have people with disabilities as the janitorial staff or the welcome desk staff, but at every point of interaction, we need individuals with disabilities represented and integrated into care to have a better understanding of what that perspective looks like across all levels. Yeah. There's some other comments that speak to the importance of presentations and conversations like these that allow space for self-reflection and create opportunity for us to think about our automatic assumptions. Absolutely. Yeah, and other sharing. We don't know what we don't know. So it takes time for us to learn. I really love Shantae's quote about the power of yet. And in teaching some of my social work classes, I would always encourage my students to remember that sometimes in our work, we are just planting the seeds. I think so often we're ready to eat from the harvest and we want to collect all of our fruits and vegetables and reap all of the benefits of our labor. But the reality is, at some points in the system, we are just planting those seeds, and other points, we're nurturing those seeds, we're watering them. And at different times, different things sprout, but it's all very important work, very timely work. And so going with that flow and understanding what the moment is calling for, it keeps me feeling hopeful and inspired of the seeds that I'm planting. I will read this comment as well. Someone shared in the Q&A, I was really touched when Shantae described some of the emotional labor of living with disabilities and insufficient supports. In my disability community, I see so many people choosing MAID, medical assistance in dying, and so often it's young folk with insufficient supports. It breaks my heart. I grieve so much for the loss, especially since there is hope of recovery. Mhm. Thank you for sharing that. Yes, yes. I think earlier someone also made a comment about the importance of collective building and community building and what it looks like for us to engage in collective care and provide support to one another. All right, so we're ready. We have one more person who'd like to share. Let's see. Andrea, are you able to unmute?
I don't think I raised my hand to share again, but did I? I'm not sure if I said something that indicated that.
Okay.
But I guess I would just add that I agree with the teaching early about disability and the sense of inclusiveness. I know in New York City there is a school that has kids with wheelchairs and they're playing on the playground with everybody else. And the kids who were in their classrooms have a different way of interacting with people with disabilities and that are visible just because they were immersed with it as if this is life. This is your, your peer group and these and that's something really beautiful to see that I had not seen before until I had moved back to New York City. So, I think that's true about all areas. And I truly think that like I do feel myself an anger and a rage and hearing these stories too, like I have advocacy fatigue also for the people that I advocate for, to be honest. Um, but even just to leave off that you've all inspired me to think about my coaching practice. Oh, I didn't even think about the lens to use because it's got to be very personalized because sometimes um people are just telling people to overcome things. You can do it. You got this. You got this. Yeah, yeah, and really acknowledging the labor and the difficulties and the barriers. And so definitely disability is a big part of it, but definitely people of color do not get respected the same way within the systems. So even by people of color, often too. So um, I guess that's what I would end with, but thank you all. But you've given me a lot of things to think about on how I can have an action plan in my ways now in which I'm working.
Awesome. Thank you, Andrea. And I will pass it to Micah for the next video.
It is the one thing in life that doesn't discriminate. It doesn't care if you're black, white, rich, poor. It doesn't discriminate. I wish that they would understand that they can find themselves in that very situation and what it was their loved ones that was simply judged based off the color of their skin or based off of their disability itself. It's not something that you can escape. The reality is that if we keep living, each and every person will meet disability in some shape or form. And so to have empathy and compassion, I think it is the leading forefront that could truly save lives. You took an oath. You took an oath to give the best quality care.
For the patients, keep looking for the right person who will listen to you. Make sure you understand your own results. If you don't understand, get the right person who will guide you to get right information. For the providers, listen to your patients. It's your right of duty. In general, healthcare is complex. Yes, but always make sure the providers treat people right.
Regardless to how much money you have, regardless to your skin color, everyone should be treated the same. I think education is the key. And we can make this world really a better place for everybody if we understood, what we don't understand. If you don't understand it, then look it up, find it out. I mean, my goodness, we got computers in our hand nowadays, where you can find out things. There's organizations everywhere where you can find out things.
Treat all people without disabilities the same respect as others.
Always ask the person what they need and then respond accordingly. The other thing that I would say is typically I run into situations, even taking my son to the doctor, where physician offices aren't always physically accessible. So even taking my son to the doctor was a challenge for us. So I would say create a space that's welcoming to everyone. When you create a physical space and an emotional atmosphere that is acceptable to everybody, then you can have a great healthcare experience.
I've become distrustful of the healthcare system. They need to improve. They need patients to work with the patients and making sure interpreters are provided. Not to push and rush things. Like, calm down. I encourage them to have a good workshop and a training. Take a class on how to interact with deaf people. Different approaches on how to communicate, including deaf-blind, how to communicate with them. Also understand different preferences. Some people prefer VRI, others in person. Accommodate their choice. They shouldn't be making decisions for us.
I wish the healthcare would understand that there are so many backgrounds and cultures. Once they get that, it's a good idea to check in with me personally to understand me. Moving forward, we will both know what to do, what I would need, the right guidance, and the right information, so we can worry less about the interpreters giving the wrong information. The doctors can clarify with me, so I don't have to worry about the interpreters. I can't ask that I prefer Black interpreters. Where are they? Where are they? That's the problem. But that's a different story. The providers lack the training and the education. You would think they should know, but that's not true. It becomes my responsibility to educate you and to explain it to you. At time of crisis, they aren't ready. No. They would always get an iPad ready. They think that thing solves everything. No, 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 that's not true.
This is Brandy. Thank you for that last video, Micah. And before we jump back into our discussion, I wanted to hold space for Sapphire, who had a question or comment before our last video. If you're ready to unmute, feel free to share.
Hello. So the only comment that I wanted to make earlier was how it was I put in the chat as well, but it was how it's in it was Andrea said how when she was in New York, it was the first time she saw like a school that was like inclusive for people in wheelchairs, and I find that so interesting because I went to one of those schools. So like I've always saw inclusivity, and like I've always saw the importance of inclusivity as a disabled person who ended up in mainstream education program. So like I feel like highlighting things like that and like highlighting things that we grew up with show the true importance of a shared story. And I wanted to comment on the last video we just saw while I have a second. I appreciated where the guy at the end said there's a importance of representation with interpreters. And as somebody who's hearing impaired, I saw that personally the first time this year I got to interact with a Black interpreter, and it was just a mind-blowing experience because they signed according to the room they were in. So it wasn't always like rapper, quote unquote. It was more they went with the vibe of the room so that I could better understand what was also going on around me.
This is Brandy. Thank you for sharing those reflections, Sapphire. Absolutely. Representation is so important. The way we communicate and interact with one another is different. So even with ASL, there's nuance into how we share different ideas and thoughts and the language and word choice that we choose. And so I appreciate that reflection. We have time for a few more reflections. If there's any questions or anyone else want to speak to that importance of representation, I'll open the floor.
I just saw an interesting chat comment, and I'm curious of if the interpreter can answer this about the importance of representation as an interpreter when it comes to those interactions.
Thank you, Sapphire. This is Brandy. Yes, Sarah or Camille, feel free to jump in.
I just know that a lot of times when I do interpreting work and it's in the Black spaces and there may be a white person in the room, how it can throw the safety of the Black space off. Because now there's someone in the room that's not, that's, it's making it so people don't feel safe. And so I preach that a lot. Also, I remember an instance where I was interpreting with a white colleague of mine, and the people were talking about getting your hair pressed. And she didn't know how to interpret that because she wasn't educated on sitting down with a hot comb and having somebody almost burn your edges, that mama thing. She didn't get that because she didn't live that. So it's very important to have that representation, but it's very rare because in our profession is it's over 85% white women. And so Black interpreters only take up it's under 10%. I can't give you the exact numbers, but I do know it's under 10%. So there's a big push, deaf Black people are realizing that they deserve to have those interpreters in those spaces. So there's a big push for that now. And so yeah, I really appreciate that being brought up. And thank you for asking me and inviting me to share my perspective.
Thank you, Sarah. Camille, is there anything you'd like to add?
So I mainly work in the community in K through 12 and some deaf blind stuff. And I had like a few several encounters when people, there's one that I'll never forget. Like I'll never forget. I volunteered for like this pro tactile, like for just like to, be a SP support service provider for someone who's also a black man. And we're doing the PT, like you touch people on your arm. He's like, wait, are you black? I'm like, yeah, I'm black. He was like, and he was just like he was just so thrilled, like, oh my God, you're black and you know PT. And I'm like, wow, like this is like, and then it was just so like I just get like chills like just thinking about that, like that moment, like how you just like so happy that I'm black and I know PT and that I'm in the space. Because most times I go to a work assignment, I'm the only one, and then I see a kid like will be like, like wow, like will be, like wave at me or smile at me because I'm there, and they see me and I see them because we're both black. So I'm not saying, and then it's very warming, but also like being in that space is a protest. Being going to work as an interpreter who's black or brown is a protest. Like showing up and doing the work and being yourself is a protest. And like I just feel like it's kind of I get chills like just thinking about it right now. But it's a beautiful thing to experience. And like we need more interpreters of black and brown, deaf interpreters too, because it's not enough of us. So that's it. Thank you for asking me.
This is Brandy. Thank you, Sarah and Camille, both for sharing. And I really appreciate that, Camille. That's something that sticks with me is this idea that our presence is a protest. And I have my tissue next to my desk because I knew that this session would definitely be emotional. But it matters. It matters. And that is a comment that's coming through from Tamika in the chat as well. Representation is so important because similar to what Sarah shared, it shapes our sense of safety, and that matters in healthcare spaces and just in the world, especially now. So thank you both for sharing. We have a few more minutes. If anyone has other comments or questions they would like to share in the Q&A. I see one question in the Q&A from Tiffany that reads, does anyone have any recommendations for resources to help medical providers learn best practices to communicate with folks with low vision and or hearing impairment? Trying to think of on-ramps for my colleagues. And Michelle responded, I don't have any handy right now, but we will find those and send them as a part of the follow-up. Thank you for asking. And so if there's anything else that folks want to respond to that request, feel free to drop it in the Q&A.
Brandy,
Yes.
I could. Thank you. I just want to come on. My name is Michelle Mead, and I have the honor of being the director of the U of M Center for Disability Health and Wellness. I am overwhelmed both by the involvement and participation that is going on today, by the comments and sharing of our panelists, by our moderators' skill and unique insights into this. And I guess I want to make sure that we continue to respect the safe spaces that are out there and to create more to allow for these conversations and allow for this problem solving to happen. Brandy, I wanted to ask you, based on your experience, how do we balance?
Yeah, that's a big question. I think that's a really big question. Um, I think the first thing that comes to my mind is the importance of vulnerability. Um, and it's twofold. Like I think there is a role for us to have these conversations in our own communities, whether that's Black community, disabled community, Black disabled community. Like there is power in us coming together where it's only folks who have those identities in that space, co-creating solutions, having dialogue, sharing their experiences. But then when we open it broader and we're inviting folks from all different aspects of the system and power differentials are in place, and we have providers and community members and institutions, all that carry a role in shaping outcomes and influencing change, it's really important that we honor and hold space for those who are most impacted, and that we're really honoring everything it takes to continuously show up and carry this story. And I think that was the biggest thing that stood out to me in developing this event and thinking about what I wanted to walk away with myself after the end of today. And I think more than anything, I can't overstate the importance of recognizing that this is not a seminar. It is not a video. It is not something that we can click on and choose to disengage with when we please, because it is everyday life. Like folks are carrying these stories. We feel it literally in our bones, in our spirit, and in all the spaces that we occupy. It sits with us. And it's something that we're dealing with on a day-to-day basis. And so just being able to hold this space for 2 hours and engage meaningfully and deeply, listen and interact, but also using that as fuel to move forward and say, like, what is it I can do for 2 seconds or 3 minutes this day to continue the conversation forward? Or how can I use my privilege and my power and position to impact change? Because for some of us, we don't have to sit in this discomfort 24/7. It is something that we can visit. And once we close the Zoom and close our laptops for the day, that's it, right? We just return back to everyday life. But for others, that is not the case. We are dealing with this consistently. And as soon as the call is off, it's like going to the next thing and trying to figure out what sustainability looks like in this time, trying to figure out what health and well-being looks like, and carrying that on a day-to-day basis. And so I think just being aware of that shift and really, really deeply honoring everything that's brought into this space. And so when I started, that was one of the things that came up to me, is thinking about how emotional this work is, because we're all coming at it from different angles and different lived experiences. And there's so much power in sharing and building solidarity amongst one another. And so I think just really reflecting in the power of community is something that carries me through, and knowing that I'm not alone, and knowing that there's folks across all levels of the system who are saying, hey, I am here for you. I am here with you, right? Let's sit in this together and really dig through what it looks like to continue pushing and working forward. So I just thank everybody who showed up today and created space for this to happen, because the conversation is just a piece of it, but it allows us to pull the curtain back on some of the deeper things that are happening and create some more space for shared understanding and action.
Thank you. And I know that when I think about how we start to move forward with this, that we begin by hopefully, responding to some of those requests that we weren't able to answer, finding the resources, making those available, summarizing the questions and the solutions that were identified. And these echo a lot of what we always hear, making sure those are highlighted. And then working in collaboration, once again, with these communities to create these solutions and make sure that they're implemented in all spaces. I think that's what we hope to do through CDHW, through the specific grant on health equity and people with disabilities from diverse communities, but mostly, knowing that we're here together and that we want, and hopefully healthcare providers, researchers are there to help create health, and that we recognize that sometimes our biases and our positionalities can get in the way, but that we can do something about it. And that this is engaging in discussions, listening like this is a step towards that. Thank you so much for facilitating this conversation. Thank you so much to our panelists, to everyone who was part of it.
Thank you, Michelle. Can I use a second? I just wanted to uplift the names of all of our film participants as well. I know many of them have been able to join us, and so I just want to give them a shout out specifically to Autumn Stevens, Diane Bass, Jamie Jr., Lisa Franklin, Matthew Stevens, Marguerite Maddox, and Shantae Favors. And I also want to extend gratitude to Teddy Dorsette and his film team for putting all of the video content together as well. Yes, so many reactions in the chat. Yes, thank you, Deaf Lens Media. We're grateful for everyone joining us today, and we will follow up with additional resources. Is there anything else that we should uplift in our final few minutes? I see there's some wonderful resources being shared in the chat, so we will be sure to share that as well as the tip sheet that was shared earlier, created by Tamika. We will pass that along via email as well. If there's any final questions or reflections, I invite folks to share in the Q&A session. The tip sheet has been reshared, and the video will be posted online on the Center for Disability Health and Wellness website. So we will share a link to that for you all to continue engaging with it beyond today's event. We will also distribute an evaluation for today's session next week. So be sure to stay tuned on email for those updates and additional resources. We hope that today's conversation and reflection extends beyond our 2-hour session and that you continue engaging with one another and us at the Center for Disability Health and Wellness as we continue moving this work forward. So thank you all again for everything that you've offered. It was an incredible discussion, great reflections, and thank you to our panelists, Lisa and Shantae. It's always a pleasure working with the both of you, and I appreciate you sharing all of the amazingness that you bring into this space with us. So thank you. And I think that's all we have. I'll pass it over back to Michelle if there's anything else that we need to close out with.
I would just want to thank folks again. Remind individuals to fill out the evaluation. You'll be sent an email with that. It may take a little longer to gather the resources that people have identified here and to develop more. But please check out the CDHW website for this video or past videos that we have available. And please keep engaged with us. We appreciate your involvement and participation so much. And thank you, Brandy, Dr. Bentley, once again, for being part of this and for doing such a wonderful, amazing job. Thank you to Ms. India Foy for managing and facilitating all of this, and for Andy Brosius for handling the logistics, and of course, Micah Wachowski for handling the videos and everything technology related. It really takes a team and a village, and I'm so fortunate that we have such a strong one here. Thank you, Dr. McKee, for welcoming us in and for making sure that this information does move forward in the clinical spaces that you interact with as well. That's what we need. We all are advocates. We are all there as witnesses and advocates to move things forward. So thank you.